Hi, I'm Eric Schaefer. I'm in BSN246. Today I'm going to be demonstrating the insertion of an NG tube, checking for correct placement, continuous monitoring and maintenance of the NG tube, and continuous documentation. So today we have orders on our patient, Mr. Smith, to insert an NG tube. These orders have been written recently by the provider based on the patient's condition of a bowel obstruction. Mr. Smith came to us recently with a bowel obstruction. The NG tube placement is going to be done so that it can be hooked up to intermittent suction. This intermittent suction is going to continuously remove contents that continues to build up and collect in the patient's stomach, and this will provide the patient with more comfort. So before we get started, I'm going to verify the order. So I'm going to log in, verify the orders, make sure that we do have the correct orders for the NG tube placement that will be hooked up to intermittent suction on the correct patient, Mr. Smith. We verified our orders. Now we're going to go ahead and gather our supplies. So I've gathered everything already. I have a large bore NG tube, absorbent pad, gloves, 60 milliliter syringe, water soluble lubricant, tape, pH test strips to check for correct placement, safety pin to attach the NG tube to the patient's gown. I have a basin filled with warm water. I have a cup of water with a straw the patient can sip. This will aid in placement of the NG tube. I have hand sanitizer, and I have a towel in case we need it. So I've gathered all of our supplies. I'm going to go ahead and head on over to the patient's room. I'm going to knock on the door. Hi, Mr. Smith. I'm Eric, your nurse. Is it okay if I come in? The patient has given us permission to come in the room. We're going to enter the room. We're going to go ahead and close the door behind us for privacy. Once I've entered the room, I want to check the patient's identification with two identifiers. So I'm checking name and date of birth. Mr. Smith, can I have you go ahead and state your full name for me and your date of birth? While the patient is stating his name and date of birth, I want to check this with the armband and make sure the information matches up. So I'm looking at the patient's armband as he's speaking. Once I've identified the patient, I'm going to go ahead and inform him and address him and tell him why we're here. So Mr. Smith, I understand that you recently came to us with a bowel obstruction. Your doctor wrote orders to place an NG tube. This tube is going to sit in your stomach. It's going to be hooked up to a suction. It's going to be there to remove some of that contents that continues to collect and build up in your stomach and provide you with some more comfort. So I've explained to the patient the procedure. At this time, I'm also going to log in, just verifying my orders. And I'm also going to be looking and checking to see if the patient has any allergies, and I want to confirm that with the patient. Mr. Smith, do you have any allergies? Patient, he states that he does not have any allergies. At this time, I'm going to ask my patient or address any questions or concerns and also further explain the procedure. So, Mr. Smith, when I insert this NG tube, it can be uncomfortable at times. I'm going to do everything that I can to make this as comfortable as possible. If you do need to stop and rest, we will do so. If you have any discomfort or have any questions or concerns, please raise your hand and we'll go ahead and stop and we'll address those immediately. So I've explained further the procedure to the patient. I've told him if he has any concerns or any discomfort, just to raise his hand, stop, and we'll provide him some rest or address those concerns as they come up. At this time, I'm going to go ahead and start setting up for the procedure. So before I do so, I'm going to apply hand sanitizer. I'm going to put on a pair of clean gloves. I want to go ahead and get the bed into a position that's going to be best for insertion of the NG tube. So I'm going to raise the level of the bed up to my height, and I'm going to get the patient sitting in an upright position. So I want that patient in a high Fowler's position. This is, of course, if the patient tolerates this. Mr. Smith, I'm going to go ahead and raise the head of your bed up. If you have any discomfort, please let me know. I'm raising the bed all the way up to a high Fowler's position. I'm going to place the absorbent pad across my patient's chest. I want to remove the NG tube from the packaging. And at this time, I want to measure the NG tube for placement. So to do this, I'm going to take the tip of the end tip of the NG tube, line that up with the tip of the patient's nose. We're going to measure back from the tip of the nose to the tragus of the ear, and from that point we want to measure down to the bottom of the xiphoid process. So for demonstration purposes, I'm going to do that on myself. I'm going to line this up with the tip of my nose. I'm measuring back to the tragus of my ear, and then I'm measuring down to the bottom of my xiphoid process. And I'm going to mark that, that measurement on the NG tube. So we're at 56 centimeters, so I want to mark that off and remember that in my head. At this time, I'm going to place the end of the NG tube in the basin of warm water and let that sit. I'm then going to remove a few pieces of tape and place those at the bedside. This will be used to anchor the NG tube once we have it in place. Okay, so we're set up to insert the NG tube. I'm going to bring the tube over closer to the patient. And at this point, I want to assess the patient and determine which nostril, which nair is going to be the best for placement of the NG tube. So to do this, I'm going to have the patient tilt his head back and hyperextend the neck. This is, of course, if the patient tolerates this. So Mr. Smith, can you go ahead and tilt your head back and look up towards the ceiling? While the patient's doing so, I want to use my pen light to assess the nairs. I'm looking for any abrasions, abnormalities, looking for intactness, looking for deviated septum, anything that's going to impair the insertion of the NG tube and help determine the best location or best site to start with. So while my patient's looking up towards the ceiling, I'm going to assess the condition of both nairs. And then, Mr. Smith, I'm going to go ahead and hold one nostril. I want you to go ahead and breathe out for me. Good. I'm going to hold the other side. Go ahead and breathe out for me. Good. So at this time, I've determined that the left nair is going to be the best location to start with for insertion. So Mr. Smith, when I begin to insert this NG tube, I want you to go ahead and look up towards the ceiling for me. As I advance it slowly, again, stop me if you have any concerns or any discomfort. Once the tube does begin to pass down into the patient's oral pharynx or to the back of the throat, this can cause a little bit of discomfort. It can cause you to gag. If this occurs, it is normal. If it does occur, we're going to stop. We're going to rest, and we're going to give you a moment before we proceed. If I meet any resistance, of course, I want to stop and do not continue to apply pressure. I want to remove the tube, again, assess the nairs, and then re-administer the the water-soluble lubricant and attempt on the opposite nair. Okay, so Mr. Smith, I'm going to have you look up towards the ceiling. I'm going to take my packet of water-soluble lubricant. I'm going to place the tip of the NG tube into the lubricant, and we'll go ahead and proceed. So again, Mr. Smith, go ahead and look up towards the ceiling. I'm going to start by inserting the NG tube in the left nair. I'm going to advance slowly. Again, if I meet resistance, I'm going to stop and withdraw the tube. For demonstration purposes, I'm just reaching back so I can aid in the passing of the tube through the mannequin. As I slowly advance the NG tube, once my patient gags, this indicates that I'm back at the in the back of the oral pharynx. I want my patient to tuck their head down and tilt their chin in towards their chest. So Mr. Smith, go ahead and bring your head forward and tilt your chin down. I'm going to rest when my patient gags and give them a moment of pause. Once we get started again, Mr. Smith, I'm going to have you go ahead and take a sip of water. While my patient takes a sip of water, I'm going to advance the tube slowly, about 5 to 10 centimeters each time. Good. Mr. Smith, take another sip of water. Good. Mr. Smith, take another sip of water. We're almost there. And one more sip of water. Good. And we're right at 56 centimeters. So at this time, I want to anchor my tube So I'm going to place one strip of tape along the patient's nose, like such, and then I'm going to wrap the opposite end of the tape around the nasogastric tube. And I'm going to take one more piece of tape and I'm going to place that to the opposite side of the patient's nose. And again, I'm going to wrap this around the NG tube to ensure that that tube stays in correct placement. Okay, so once my tube is in place and I verified that it is at 56 centimeters, I want to verify placement and make sure that tube is sitting in the right location. We want to make sure that tube is sitting in the stomach and not in the lungs. To do this, of course, we're going to follow hospital policy on what is recommended. Of course, the best, most appropriate determination of tube placement is through chest x-ray. So if chest x-ray is available, we're going to use chest x-ray to determine placement of that tube. We're also going to check pH. So to do this, we're going to take our 60 ml syringe. We're going to aspirate the NG tube. So we're going to remove the tip. I'm going to insert my 60 ml syringe. I'm going to remove approximately 5 to 10 milliliters of stomach contents from the NG tube. I will empty the stomach contents of the syringe into the basin, and I'm going to use my test strips to check the pH of the stomach contents that I've removed. pH test strips indicate that it is at a pH of 3, so we do know that it is in the right location. It is in the stomach and not the lungs. pH of the stomach contents should it be anywhere between 1 to 5, and our pH test strip indicates that it's at a 3. So at this time, I'm going to go ahead and attach the tube to the patient's gown. I'm going to do this by placing a piece of tape along my NG tube. I'm going to then use the safety pin. I'm going to insert that through my tab of tape, and I'm going to then attach that to the shoulder of my patient's gown. Once that is attached, then we're going to hook that up to suction as ordered by the patient's provider. So Mr. Smith, your doctor wants us to hook your NG tube up to suction. This is going to be located on the wall behind you. It's going to be an intermittent suction, so it's going to be going on and off. So you're going to hear kind of like a vibrating noise. It's going to go on and off. This is going to help remove some of that contents of your stomach that's causing the irritation from the bowel obstruction. So I'm going to hook up the tube to the canister on the wall behind you. At this time, I want to monitor and observe the contents that is coming out from the suction. So I'm looking at color, consistency, and total volume, and we want to document and record those observations. So at this time, I'm going to go ahead and put my patient back into a position of comfort. I want to lower the bed, so I'm bringing the bed back all the way back down to the floor. This is for safety precautions. And then I want to, of course, lower the head of the bed. The patient's probably not going to be comfortable sitting in a high phalanx position for too long, so we want to put him in a position of comfort. So Mr. Smith, I'm going to go ahead and lay your head back. I want you to tell me when you're most comfortable, and we'll go ahead and stop. So I'm laying the head of the patient's bed back. We're going to leave him in a semi-phalanx position as the patient indicates that is the most comfortable position at the moment. I'm going to bring the call light over. I'm going to place that in front of my patient. So Mr. Smith, I'm going to put your call light here. Hit the red button on your call light if you have any questions or concerns or need anything from me. That will let me know to come over and help you. We also want to continuously monitor our NG tube. So we're going to follow hospital policy on continuous monitoring. At minimum, we want to check the tube every 6 hours. So we're checking to determine that we have that our tube is still in the correct placement. We want to look and make sure that that tube lines up, and that 56 centimeter mark lines up with the opening of the patient's nostril. We want to continuously monitor the contents that is coming out of the patient's stomach, the color, the consistency, the volume. We want to determine patency, make sure there's no occlusions. We also want to, so at minimum, we want to check and monitor the placement of the tube every 6 hours. We're doing this, of course, by measuring or checking the depth mark on the NG tube, and also checking the pH indicator on the test strip. We also want to do this anytime that we are starting or stopping suction, and anytime that we're administering any enteral nutrition. We, of course, want to make sure that the placement of that chest tube is still sitting in the stomach. Anytime we're administering anything through the nasogastric tube, we want to make sure that it's sitting in the stomach and not in the lungs. So we're going to be checking tube placement minimum every 6 hours, or anytime we're administering any enteral nutrition. At this point, I want to ask my question if he has any questions or concerns. So, Mr. Smith, do you have anything, any questions for me? No? Is anything bothering you at the moment? And are you comfortable? So patient stated that he's comfortable. He has no questions or concerns. So at this point, we're going to go ahead and step out of the room. So I'm going to go ahead and remove my gloves. I'm going to apply hand sanitizer. I'm going to go ahead and step out, and we're going to go ahead and document our procedure. When I'm documenting the procedure, I want to make sure that I'm documenting the location of the nasogastric tube. So we inserted the nasogastric tube in the left nostril. So left nair, we're going to document that. We want to document the depth of the tubing at 56 centimeters. We want to document how well the patient tolerated the insertion of the NG tube. We're going to document the contents of the contents of the patient's stomach. So the color, the consistency, and the total volume that is being removed. And that concludes our procedure. Thank you.